Hi, I'm Garvin Lynch. Welcome to Lynch's Pharmacy video series. This video is on acne. So acne is a very common condition. We see it a lot in the pharmacy and is usually very treatable. It may take a couple of months to clear spots, and even after that it requires a long time of maintenance treatment just to keep them at bay. Acne is the most common cause of spots. It affects people between the ages of 20 to 25 normally, but you can get them younger or older than this. They usually affect the face, but you can get them on the neck, the shoulders, the back or the chest as well. Symptoms tend to vary from very mild to very severe and debilitating. Under normal circumstances, in our skin we have sebaceous glands which secrete an oil substance called sebum. It comes up through the pores and out onto the skin just to keep it healthy and supple. In teenagers especially, during puberty they excrete a lot more sebum, and this tends to block up the pores and cause spots. In mild acne, those pores become blocked and can be seen as whiteheads or blackheads, and the oily substance beneath them becomes trapped underneath, and that's what causes the red pimple or papule, which is the red part of the spot. In more severe acne, the trapped sebum underneath the blocked pore is an ideal breeding ground for germs and bacteria. In severe acne, you can get quite a lot of bacterial growth and you get inflammation as a result. So you can get a very inflamed and very painful spot, which can lead to scarring afterwards. Just the simple whiteheads and blackheads don't usually lead to scarring, but if there's any inflammation present, there may be a scar there afterwards. A couple of things that can aggravate or make acne worse. For women, the progesterone-only contraceptive pill can make acne worse. In the same way, the hormonal changes around the monthly period can cause a flare-up as well. Picking or squeezing spots can also make them worse as well, as sweating heavily or humid conditions and things like wearing tight clothes. Some drugs can cause acne or make acne worse, like phenytoin, which is used for epilepsy, and steroid creams or ointments used for eczema can cause a flare-up of acne, as well as anabolic steroids. They can also cause a breakout of spots. There's also a lot of myths surrounding acne which just aren't true at all. For instance, it isn't caused by poor hygiene. In fact, excessive washing can make acne worse. Diet has little effect on acne, so eating chocolate isn't likely to give you spots. Stress doesn't cause acne. Acne can't be cured by drinking lots of water. There's no evidence to say that sunbathing or sunbeds can clear spots. Again, some people have said that it can. Some people think that there are no medical treatments that do anything for acne, when in actual fact, when treatments are used correctly, they can be quite effective. Some general skincare advice for people with acne includes washing as normal. Don't wash any more than you have to. People with spots can become quite obsessive about it, and understandably will start washing themselves far too much. Twice a day is normal for anybody. There's no reason why anybody with spots needs to wash more than that. As I say, it can do more damage than good in the long run. You can clean off a blackhead. Some people think it's dirt or grit or something blocking the pore, but it's actually a pigment in your skin called melanin. So no amount of rubbing is going to get rid of it. If somebody has a lot of spots, it's likely that they'll be using some sort of product. Some of these can dry out the skin quite badly, so it's advised to use a fragrance-free, water-based moisturiser just to keep the skin hydrated. The aim is to clear the spots and keep them at bay. Generally, no matter how good the treatment is, it's not going to clear the skin completely. There will always be more than likely always be one or two spots left, but some of them can clear quite considerably. The Clearasil range has various products and lotions and washes. It's debatable how effective they are. Some people say it has worked great for them, and other people say that they did nothing at all. So it's about trial and error. But as I say, do seem to work for some people. The drug benzyl peroxide is far more effective and tried and tested for treating acne. Acnicide is the brand. Panoxin is another brand. It's the same drug. It's quite a severe treatment, but it tends to work quite well. A couple of points with it. It's best to wash the skin 20 or 30 minutes before using it. So have a wash, wait a half an hour, and then apply it. So the patient might bleach their hair, bedclothes, whatever clothes they were wearing. It commonly causes skin irritation. If it does, stop using bleaches on your hair and clothes, as it can cause problems for acne. So to lower or avoid getting the skin irritation, remember to apply the cream daily at first and wash off after a few hours. Gradually increase the amount of time you leave it on and eventually aim to use it twice a day. As I say, it does work quite well. There are quite a few other products used to treat acne, but they're on prescription. So the likes of the retinoids, topical antibiotics, oral antibiotics, and isotretinoin tablets. These are all commonly used to treat severe acne in patients, but they're on prescription and would need a referral to go to your GP for further advice. In terms of how long treatment is needed for, generally an effect would be seen after 4 weeks, but it can commonly take 6 weeks and even a month or 2 months to see real noticeable effect. The most common cause for treatments not working in patients is patients don't use them for long enough. They use them for a couple of weeks, they don't see enough of improvement, so they just stop. So it's important for the patient to stick with their treatment for at least 6 weeks and see. If after 6 weeks or 2 months they don't see a huge improvement and there are no other options that can be tried, then go back to your doctor for further advice. It's important to remember that this will take time. Even after you found a treatment that works and the spots have cleared considerably, it's important to know that they're going to need maintenance treatment afterwards to keep them at bay. Often this can go on for as long as 4 or 5 years, until your late teens or early 20s, sometimes even into their 30s. For maintenance, you'd usually use benzyl peroxide. Just apply the cream maybe once or twice daily, depending on how likely they are to get a flare-up. So acne can be treated with over-the-counter products, which can be very distressing for a young teenager if they have very severe inflamed acne. A person may be referred to a doctor if it looks like they need it, where they can get proper prescription treatment, which will be much stronger than you can buy over-the-counter products. So if you have any other questions on acne, you can contact me through the Life Pharmacist, email me, or call into the pharmacy here in Broaddale in Douglas. Thank you for watching.